So as you will realize, such tasks will require working with multiple stakeholders so that you are actually be able to leverage on the different strengths and abilities that they come with. Like for Southern Province, I'll speak for Southern Province, we are currently working with the DAP, TCE, and these are people this is an organization that is actually helping us, especially with community-related kind of activities. To speak to the first 95, which talks about ensuring that those that are HIV positive in the community are actually identified. The Ministry of Health adopted the index testing modality, which is a more focused way of finding people with testing people for HIV. And we've been working hand in hand with DAP to ensure that from the clients or contacts that are elicited, using their systems, they're able to track these contacts within the community and have those tested. And for those that are found to be positive, we rapidly initiate them on ART. We are coming from an era where we used to spend quite a lot of resources to try to identify very few positives, because what we used to do is just try to do blanket kind of testing. Okay, this is a resource, and a resource we have to manage them very well. When we started implementation of index testing, of course we had those teething problems, issues of confidentiality, anonymity, and other things. But what we have seen in terms of our data, even the number of tests that we need to conduct has actually somehow reduced, meaning we are saving some of these testing kits for other areas like in maternal and new child born, where we would want to ensure that we are having those, we are testing as many of those subpopulation. So in a way, it has helped because we are being precise with the way we are actually following the HIV, as opposed to the initial strategy where we will just test everyone. So what usually happens is once the patient comes through and they are identified to be HIV positive, of course the process of elicitation comes through, and this is done by trained providers that have actually been trained in ethical indexing, as well as ensuring that they have sworn to confidentiality. And then thereafter, we try to follow them depending on the modality that this client is actually comfortable with, so that we do not break that anonymity, to ensure that we're in keeping with the standards that are actually being propagated by WHO and other international organizations.